continue with the cardiovascular system related topics. Today we'll talk something about hypertension. Hypertension, it's a big topic actually. It's a big subject by itself. As I was telling you earlier, hypertension has become a field of specialty, subspecialty in cardiovascular system. There are many specialists who are hypertensionologists. So it's not just one disease, it's a big syndrome. There is a very big book on hypertension. So you may get any small topic as your examination question, short notes or long questions. So hypertension is a very common disease, as you all know, and it is becoming increasingly common now because of various reasons. Because we have more of elderly people today, and the lifestyle has changed, and urbanization, westernization, all these things are food habits, lack of exercise is contributing to the increasing number of hypertension patients in the world. It's a very common disease, increasingly common disease. As you all know, the risk factor for hypertension is age. As you are aging, yesterday I was drawing a graph of cardiovascular disease, same thing applies. Male, female. So the graph goes something like that. And again, when it comes and touches the male.
Mike.
Hello, can you hear? Right?
Just connected.
Yeah, as we were discussing yesterday, the incidence of cardiovascular disease and the age-related changes, same thing is true with hypertension also. Males, as they age, it goes on increasing. Females also go increase, but when they become 50, they touch almost the male type of incidence. So that is the age. Age is one of the risk factors for hypertension. Gender, of course, male, female, we were discussing yesterday. All these years, we were thinking that males are more prone for hypertension, but now females are also equally prone for hypertension, and overweight itself is another independent risk factor. People who are obese are also at risk of developing hypertension anytime in their lifetime. Physical inactivity is one very important thing. Physical inactivity. People who are homebound or not doing any physical activities, people who are having less physical activity are more prone for development of hypertension. Smokers, of course, smokers are also at high risk, and there's a family history because hypertension is a genetic disease. It runs in families. So anybody has a family history of hypertension in any of the family members, so these people are at risk. And hyperlipidemias, hypercholesterolemia, hyperlipidemias are also an independent risk factor. Diabetes. Many people don't know that diabetes also is one of the risk factors for future development of hypertension. We think that they are two independent diseases, but then 80% of diabetes patients, 80% of diabetic patients will have hypertension, and diabetes is a risk factor for development of hypertension for various reasons. Same thing is true with hypertension. 80% of 20% of hypertension patients will have diabetes. But 20, if 100 people are hypertensive, 20 of them will develop diabetes in future. And if 100 people are diabetic, 80% will have hypertension in future. That is the number. So 95% of the hypertension are primary. Primary, when I say, what is the meaning of primary hypertension? Which is essential hypertension or idiopathic hypertension. Hypertension unknown EPO. 95% of the time, we don't know what exactly the cause of hypertension. That's why you call it as primary hypertension or idiopathic or essential hypertension. All mean same. So 90% unknown cause. Only 5% are secondary hypertension. They are due to various causes of causes related to kidney disease, thyroid disease, or adrenal gland disease. Okay.
Yeah, coming. So I think charging barabar nahi हुई.
हेलो ये चार्ज नहीं हेलो yeah this one or this okay so 5% of the patients of hypertension are secondary hypertension 95% are primary essential hypertension and 5% are secondary hypertension. Secondary hypertension, as I said, it can be because of kidney disease, because of the thyroid disease, or because of the adrenal gland disease, or pituitary related or any brain related diseases. That is secondary hypertension. But the age usually 40 years or above 40 will get hypertension. It was true for some years, but now things are changing. Younger patients, so younger people also getting the disease of hypertension. We are seeing patients with 35 years, 30 years, 28 years, 25 years, and 20 years also we have seen hypertension. Many people, I have many patients who are just 20 and having hypertension. So usually when somebody is below 40, we think it could be secondary hypertension. When somebody is above 40, we think it is a primary hypertension or essential hypertension. But now the things are changing. The primary hypertension is also occurring in old people, and the secondary hypertension also is occurring in the old people, and primary hypertension also, the essential hypertension also is occurring in young people. Many times people who are 25, 26, 27 years, when they come to us with hypertension, first we think in terms secondary hypertension, and then we investigate. When all investigations are normal, we brand them, we label them as